Hello and welcome to a live video podcast brought to you by Parabit Systems. My name is Gabrielle and I'll be your host for today's episode. Today we're joined by Rob Laponis, CEO of Parabit Systems, Kevin Whaley, Director of Safety and Security at the George Washington University Hospital, and Stephen Biscotti, Director of Safety and Security at Mount Sinai South Nassau Hospital. And in today's episode, we're going to be talking about what goes into modernizing healthcare security today. Thank you for joining and welcome. Awesome. So let's go ahead and get started with a little introduction. If you can, tell me a little bit about George Washington University Hospital and your role within it. Let's go ahead and start with Rob.
Hi, my name is Rob Laponis from Parabit Systems. We're the provider of visitor management solutions, especially kiosk hardware and software for both of our clients on the chat with us today.
George Washington University Hospital is a hospital located in the nation's capital, Washington, D.C. It's a level 1 trauma center. We have 400 plus beds. It's a unique environment. We have an inpatient mental health unit and ED that can see between 200 to 350 patients a day. So it's a pretty active environment inside of an urban, Washington, D.C. So it has it's a unique place to work. From day to day, we see all kinds of different things here in the nation's capital.
I bet. Thank you. And Stephen.
Hey, good afternoon, everybody. Stephen Biscotti, Director of Safety and Security at Mount Sinai South Nassau in Oceanside, New York, located in Long Island. We're a 455-bed hospital. We are at capacity on most days, and we have a visitor census of approximately 1,000 visitors per day pre-COVID, and we're running about 350 visitors per day post-COVID.
Wow, wonderful. So this next question is for Kevin and Stephen, although Rob, feel free to jump in if you have something to add. From your respective positions as directors of safety and security, what do you think are some of the biggest challenges around hospital security in general, but also more specifically at GWU and South Nassau? Let's go ahead and start with Kevin.
Yeah, so the challenges you have is healthcare security is unlike any other type of security in that you're in an environment where folks are coming here not because you're having a good day. You're not sitting at home saying, what do you want to do today, honey or wife or husband, whatever. Like, I'll go to the hospital and sit in the emergency room for 4.5 or 8 hours and watch free cable TV. You're here because either you're sick, injured, or hurt, or someone you care about is sick, injured, or hurt. So that adds a level of tension and anxiety throughout the facility. We've got folks that, unfortunately, someone can pass, every day, and someone's born here every day. And we deal with everything in between that. Trying to balance that challenge while trying to provide a safe and secure environment for all of our patient staff and our visitors here at the hospital can be challenging. Trying to have that balance to demonstrate empathy while also trying to keep everybody safe and trying to make sure that folks act appropriately, and so we can treat them and provide the highest level of healthcare services we can here at GW Hospital.
Absolutely. And Stephen, what do you think some of the biggest challenges are around hospital security?
Well, I have to concur with Kevin. I think this is, it can be interchangeable, both visitor management and workplace violence. Visitor management, where we have a very strict visitor policy in place where it's only 2 visitors per day from 12 to 8. And as you can see what's happening around the world, especially here in the United States, especially in New York, workplace violence is on the rise. So we try to provide the highest level of safety and security to our patients, staff, and visitors 365 days a year. And it's very, very challenging, believe me.
No, I do believe you. There's plenty of challenges that go along with security. And, with the presence of these challenges attached specifically to hospital security, you were able to come up with an innovative solution in response. So can you please speak a little to how you came up with the idea of implementing a visitor management system and what exactly led you to this solution? Let's go ahead and start with Kevin.
Yeah, so it's a unique story. So for me, it came to me when I've been traveling for work a lot, obviously pre-COVID. I've been traveling a lot for work, and I was at the airport, and I just realized over time the difference between you stand in the lines and go up to the counter, and there's like 4 or 5 people at the counter, and you had 5 or 6 staff members back there checking you in, checking your bags and whatever. And how over the last several years they transitioned to having kiosks. So you can have 6 or 7 kiosks out there, and you have one person who stands there and can manage 6 or 7 kiosks and direct folks in, check them in, so on and so forth. So that's kind of where the original idea came to me as far as looking at other options as far as kiosks were concerned. And then also for us, it was a matter of finding partners, I should say more than one partners, that were willing to work with us to take what our physical process was here at GW Hospital of screening visitors coming in and checking them, which was the visitor comes in, we ask them who they're here to visit, they provide the patient's name, we verify that patient's name by a printed out census or in the computer and SMS. We then ask for photo ID, we look at the photo ID, we then had them print their name on a little sign-in sheet, and then we would issue a color wristband that was specific for that particular day, and then tell that visitor where they were going in the hospital, a particular unit or floor they were going to. So trying to find a partner that was willing to take that manual process and put it into technology. We were fortunate enough to partner with Parabit and Stopware, through Patches Points, the actual VMS, the visitor management system itself, the software, to develop from a thought to actual implementation to actually physically rolling it out here at GW Hospital. So where we are able to actually verify a visitor to the patient by HL7 integrations, that's systems integration between the Parabit and our SMS software, so that in real time, when a patient comes in and checks in at the kiosk or at the workstation, you type in the patient's name, and it verifies A, is the patient here in the hospital? B, can they receive the visitors? And if to Stephen's point earlier, we're at one visitor per patient per day, code protocols to say that as well to make sure they haven't already had a visitor for the day. So it's like I said, from going from a thought to implementation and working with Rob and his team have been phenomenal to bring this to fruition. We're very, very excited about this.
That's incredible. And Stephen, what led you to this solution?
Well, almost similar to Kevin, my doctor's office, my dentist's office, and my eye doctor all utilize kiosks. So I actually had the permission of the offices to take a picture of their systems and spoke with my leadership here and said, well, why can't we bring visitor management into the hospital? And we do have an open architectural design. We implemented kiosks at a multitude of entrances, our main entrance, our ambulatory entrance, and our emergency room entrance. And the whole premise behind that was the Parabit system requires either a New York State driver's license or a passport. It captures the photo. It also takes a picture. We were able to obtain the personal information of the individual, and we store it on our network. And we have a network that can store for infinity. So God forbid we did have to go back and take a look at someone for whatever the issue may be, an unusual occurrence, etc. We have the ability of going back and locating an individual and have him already identified.
Absolutely. And, keeping tabs, as you described, on visitor management is just such an important component of hospital security. And this solution you created is a great way to take care of that responsibility. And, that kind of leads us into our next question, which is, what is your philosophy on visitor management in the healthcare space? And a follow-up to that, what do you think are the gaps in traditional hospital visitor management systems? Let's go ahead and start with Kevin.
Yeah, so typically what I noticed was, as I mentioned earlier about having been able to partner and finding Rob and finding our partners at Stopware was there's, I want to say, a dozen other visitor management systems out there that really aren't really visitor management. It's more of like a visitor tracking sort of software because it doesn't have the technology to where you can integrate in HL7 integration. So it's going to require your IT team within your hospital to work with Passage Point and Parabit to develop the codes and all the directory. I'm not an IT guy, but that's how they did it. To work it together to where you have that real confirmation of that a visitor is here to see an actual patient that's in your hospital versus the other systems where, yes, they scan your ID, yes, they take your picture, and yes, you put in the patient's name, but they don't have that that integration to be able to verify that that patient is actually in your hospital. The patient can have a visitor. For instance, for us, we have a special attention list. So we have visitors that, as I said, we're a level 1 trauma center. So I've got patients here that are victims of gunshots, violence, stabbings, domestic violence. I've got, being here in Washington, D.C., we have what we call high-level protectees. That could be everyone from a government official to a foreign dignitary that could be here at the hospital seeking treatment or visiting a patient. So there's a level of visitor restrictions here at the hospital. And to Steve's point, my hospital here is not an open campus, it's a closed campus. So we control our entry points to the public, to the ED entrance and our main entrance. So having that true visitor management really makes a difference for us. And to Steve's point earlier about being able to go back, we've been having utilized this system. We've been able to not only go back and look at nefarious acts. For instance, a patient who was an outpatient for radiology stole the receptionist's cell phone from the front of his desk and walked out the front door. So we were able to identify who that patient was, get a name, ID, and so on and so forth. When we contact law enforcement, we had all the information available for them.
Awesome. And Stephen, what is your philosophy on visitor management in the healthcare space?
So I have to concur with Kevin on all facets of what he just said, but it was vetting out the vendor, what was going to be the best fit for South Nassau, and luckily for us, Parabit is only about a 20-minute drive away. So going with the local vendor was very, very important. The HL licensing also attracted us to Parabit, which does create that integration that Kevin just spoke about, and implementing other hardware and software security applications. And of course, the denominator in this entire package is staffing. And we have a very high level of staffing here. We only hire high level security professionals, retired law enforcement, and veterans here at South Nassau.
Absolutely. And do you have any actionable steps that hospitals and healthcare systems can take today to get just one step closer to modernizing their current security system so they're up to date? Kevin?
The biggest recommendation I would recommend is working with your integrators. I think to Steve's point earlier, I'm not around the corner from Rob and Parabit, but his partners, Heather Gleason, is one of the folks that works for Rob, have been great partners with me. I got to go up to Parabit. They're located up in Long Island, New York. I got to take the train. I took the Long Island Express train for the first time in my life. That was an adventure, to say the least. But I got to go meet with Rob and his team as engineers to literally discuss the fabrication. They've actually designed and fabricated the kiosk to meet our needs. What I mean by that is that here at GW, we don't use what other systems may have, a visitor sticker, as you see a lot of folks wearing the stickers on their clothes. We worked with Parabit to manufacture and design the kiosk to be able to hold and maintain wristbands. So when we're done checking in, it prints out a wristband, and on that wristband it has the date, it has the patient's room that they're going to, the bed, and the floor number for that visitor. The biggest important thing, like I said, there is that date there for us, so that when someone's coming back in the next day or something like that, we make sure that we give them an updated wristband by checking them back into the kiosk. That's where I look at it as far as system integration. The more systems you can integrate underneath each other, for instance, your video, your access control, and your visitor management underneath one umbrella, and the more integrated they are, the better off you'll be, and to be able to expand, as we're always growing. Healthcare security is ever changing. Nothing's set in stone in healthcare. You got to be able to flow and ebb with the changes in times and the environments that you have. So my recommendation would be to partner with a good integrator, find a good integrator if you can, and you do, and partner with them to work on any and all the challenges that we see every single day in healthcare.
Absolutely. Those are some great steps to take. And Stephen, do you have any actionable insights?
So again, I'm going to agree with everything that Kevin said. I think you really have to look from the outside of the box in, look at what your architectural design is. I think we've partnered with a very good company in Parabit, and this is just the beginning. We need to implement more security control systems. We need to, down the road, I think, looking at best practices. There are other competitive hospitals out there that are using the optical access control turnstiles, which just act as another layer, another barrier for visitor management, for visitor control, trying to keep everybody on the up and up, trying to keep everybody happy, keeping the lines down and getting them through as quickly as possible. So you do go to some hospitals, we all visit hospitals, and nobody wants to wait on the long lines like Disney has. And what happens? People start getting upset. They become irate, and they start venting on the wrong people. They're venting on the people that are looking to help themselves. So we're trying to look outside the box with a think tank to see how we could streamline that process, segregating the employees coming into the institution from a multitude of employee entrances, and keeping the community coming into a main entrance. So taking all of that in, into consideration. There's a lot of work that still needs to be done in the healthcare community, but I think working collectively like we do here in Long Island, um, with our other hospitals and our security director forum that we have here in Long Island. We do meet quarterly and we discuss what's happening in the healthcare community and what's out there. And we do invite vendors in and see what they have and what might be the best practice, not for just today, but for the future as well.
Absolutely, and those are great steps to have now in the present and working towards the future, towards hospital security. Rob, do you have anything to add here?
Yeah, just creating a solution that improves workflows, improves security, validates credentials of people, being able to validate that, if someone is allowed into a space for a certain amount of time and then not allowing them in afterwards as a second visitor, being able to do background checks on people as they enter the facility and blocking out people from entering facilities that shouldn't be visiting patients within the hospital, and just eliminating contact points. I mean, so to me, visitor management is a much more efficient solution served as a kiosk solution than it is as a manned guard solution, because it eliminates the interface of people handling credentials back and forth to a guard and to the people that are visiting the hospitals in this day and age. You really want to minimize how much contact that you come into with people. All of our kiosks have antimicrobial touch points protection on them. The newer kiosks that we're fabricating have antimicrobial powder coating surfaces that we're implementing. So we're all about trying to constantly innovate what we create, work with our partners to address their specific needs, understand their workflows, and work with our partner Stopware to come up with the solutions that directly satisfy all of their work requirements, so that way they can minimize the cost and provide a safer environment for the hospital industry.
Absolutely, and that constant innovation is what is keeping you guys so successful and just ahead of the curve when it comes to hospital security. Well, just thank you so much for these actionable insights when it comes to modernizing healthcare security in hospitals. And I want to ask, do you have any last thoughts or points you'd like to share for the audience watching?
I just think it's really important for, as Steve and Kevin had outlined, that, visitor management is one point, but integrating biometrics with, like as Stephen mentioned, with turnstiles, with utilizing solutions that will work with fingerprint scanning or facial recognition, so that way visitors can be pre-screened before they enter a facility. So there's even more of a better security measure to minimize, any threats that potentially could come into the hospital. Automate the workflows to make it less expensive to operate their hospitals and provide a safer environment, I think, is extremely important. Improving security surveillance measures throughout the facility to protect their staff as well as the patients, I think, is imperative in these days and times. Unfortunately, as we all are experiencing, unfortunately, the world is increasingly and rapidly becoming an unsafer place. So we're constantly needing to stay on the edge and develop technologies to protect, the patients, the visitors, and the employees of the hospital industry.
Absolutely. Well, thank you for that. And well, that's all we have for today's content. So just a big thank you to Kevin, Stephen, and Rob for joining us today and speaking to how we can modernize healthcare security solutions. If you want to check out more content from Parabit Systems, look for this podcast on Spotify, Apple Music, or wherever it is you get your podcasts at. Thanks again for joining us.
Thank you.
Thank you.